Hi, this is Gordy Rush along with Dr. John Perenack, and we are here today for an episode of MAN-taining, courtesy of the Williamson Cosmetic Center. And today, how about this? We're talking about hair today, loss tomorrow.
Indeed, because hair loss for men is such a big issue.
Yes.
It certainly affects their confidence, affects the way they feel when they're presenting to the world, and there's so many good treatments out there, surgical and non-surgical, to make things better.
And the great thing, Williamson Cosmetic Center has been on the cutting edge, and the technology's improved for helping men and women out there with hair restoration.
Yeah, and that's a good point, because women have hair loss oftentimes in a more devastating way than men do, because whereas men, we tend to lose it in the temples, we may lose it at the vertex, and they certainly can coalesce. Women tend to go globally thin or globally bald. So we want to help women as much as we want to help men, and we have these different options for them.
So take me through what happens when there's the bald spot versus receding hairline.
Yeah, really, when we look at either androgenic alopecia type or a female pattern hair loss, we're going to be looking at the hair follicles, causing a miniaturization of the hair. So we look at the front of the leading edge. In men, it's going to be miniaturizing the hair, and eventually we're going to have the follicles stop working. Hair will be shed and exfoliated. And we have a brief time period there where 6 months to 12 months where we can actually maybe intercept, bringing those follicles back online and get the hair to grow again. But once hair has been lost for longer than a year, we start looking at things like grafting. And we have grafting options to basically put more trees back in the forest after we've lost the forest.
I got you. Yeah. How about women? Is it a different treatment than men?
For the most part with women, we're going to be trying to prevent having to graft, and we want to get it early, and we'll be treating with things like PRP, or platelet-rich plasma therapy, which also contains an awful lot of exosomes, and you may hear about exosomes in the industry right now, which is a bit of a buzzword, and also things like red light therapy, topicals, and of course nutraceuticals that can help out.
So for men, at about 35, they start to lose hair. What's the cause of that?
It is largely mediated through dihydrotestosterone. So testosterone, our body produces it in and around the hair follicle, gets converted to dihydrotestosterone, and for whatever reason, genetically, some men and some women are predisposed to it, causing the hair follicle to start to make a miniaturized hair and then eventually lose the hair entirely. So when we start thinking about things that we can do to intercept at an early stage, they're going to be looking at two different ways. Primarily, increasing blood supply to the hair follicle, increasing basically oxygen tension rather, nitric oxide, which actually acts as a bit of a growth hormone for the hair. And then the other thing is blocking the production or the binding of DHT to the hair follicle.
So Dr. Perenack, I remember my first procedure like it was yesterday. I know you do too, because it was back in 2012, a very important date in LSU history.
It sure was. I mean, there you were on the table, and I think we'd harvested the raft, and you were getting up, and we were going to be making the sights, and then we got the word that the LSU had let the honey badger go.
Yes.
A day in infamy.
Yes, it was. And the phone was ringing as I was trying to get my hair restored, and so it was a crazy day. So that was 2012. So I know you've been doing it way before 2012.
Yeah, honestly, I've been doing this for about almost 25 years. And it's been neat because the technology and a lot of the procedures have evolved through that time, and it's made it easier for patients. It's made it a whole lot less uncomfortable than it used to be 15 years ago. And it's just better all the way around, yeah.
And the great thing, I think folks would need to realize, you have a tremendous reputation. There are people that come from other states to come see you.
Yeah, interesting enough, we've had people from California and New York City. I once had somebody come from England. I mean, that's a long ways to go for hair.
Absolutely.
It sure is. So it's fun. We get to meet a lot of different people in what we do.
Do supplements, post-supplements, after you have the hair restoration, those work? Can they help?
They do. I'm not a big vitamin guy. Certainly if you look at like Dave Asprey and these guys biohacking, but there is something really to it, because hair follicles are a complex structure, and they need a number of things, biotin, copper, peptides, and a number of other things. So I do like the nutraceuticals. We certainly have our brand. There are other ones out there, but I think whatever you're trying to do with your hair journey makes good sense to do.
Excellent. Thank you for watching this episode of MAN-taining with the Williamson Cosmetic Center and Perenack Surgery Center. I'm Gordy Rush. This is Dr. John Perenack. And to book your eval, please call 225-927-7546 or go online to williamsoncosmeticcenter.com. cosmetic.com.